A methodical approach to assessing the dry eye. Assessing the dry eye for potential Raindrop Near Vision Inlay candidates is a crucial step in patient selection. In this video, you will learn an easy method for assessing dry eye. It is very important to screen for dry eye syndrome because it may lead to potential post-op complications such as poor visual outcomes due to an unstable ocular surface, higher risk for post-op inflammation or haze, and prolonged discomfort and healing. There are numerous tests to assess dry eyes, and no one test is completely definitive. Therefore, we suggest evaluating and testing the ocular surface and adnexa starting from the most anterior surface and working back through the lid margin, the tear film, and finally the cornea. When evaluating the blink, check for incomplete lid closure, partial or infrequent blinking. In this video clip, we see a partial blink pattern whereby the upper and lower lids never meet, thus leading to drying out of the tear film over the lower one-third of the cornea. This can lead to exposure keratitis. After blink analysis, assess the lid margins. Look specifically for signs of meibomian gland dysfunction, or MGD, including debris on the lashes, clogged or obstructed glands. Look for red scaly margins and thickened meibum that can be manually expressed by pressing on the lid margin. Next, evaluate the tear film. It is composed of 3 layers. The most anterior is the lipid or oil layer, which lubricates and prevents tear evaporation. Posterior to that is the aqueous layer, the thickest of the 3 layers, which nourishes and protects the cornea. And finally, the mucin layer, which adheres the tears to the cornea. Each layer can be clinically evaluated, but for the purposes of this presentation, we will only look at those tests for the lipid and aqueous layers. The mucin layer can be analyzed with impression cytology, but it is not a commonly used clinical test. Most dry eye patients have evaporative syndrome, which is commonly caused by MGD. MGD reduces the lipid layer and subsequently allows the tears to rapidly evaporate from the ocular surface. This video clip demonstrates the tear breakup test for a dry eye patient. After a complete blink, you will see the tears evaporate within 2 seconds in the blackened, tearless areas that appear throughout the tear film. A normal tear breakup test is 8 seconds or greater. Another means of testing the lipid layer is with LipiView by Tear Science. This is a normal lipid layer as seen in the oily rainbow area, similar to how you would see car oil in a puddle. When the upper lid touches the lower lid when blinking, the lipid is pulled upward over the ocular surface. These are the recommended steps for performing a Schirmer's test with anesthetic. Instill 1 drop of anesthetic into each eye. Using a slightly moistened cotton tip swab, gently dry the inferior cul-de-sac. Place prepared Schirmer's strips into the inferior cul-de-sac halfway between the center of the lower lid and the lateral canthus. Instruct patient to close eyes. Wait 5 minutes. Remove strips and measure height of moistened area in millimeters. Dry eyes less than 10 millimeters. Normal greater than or equal to 10 millimeters. Another test of the aqueous layer is to evaluate the height of the tear meniscus. It is best performed using fluorescein dye. The quality of tears is also important. Tear Lab's tear osmolarity testing measures the concentration of electrolytes in the tear film. It is used mostly as a test to support other dry eye findings. Lastly, evaluate the cornea with a slit lamp using fluorescein or lissamine green dye. Look for punctate epithelial erosions, especially in patterns, which could indicate dry eye problems. In the upper left photo, the inferior arcuate staining pattern reveals exposure keratitis. In the lower right photo, the staining of the upper and lower thirds of the cornea indicates epithelial cell injury from bacterial toxins commonly found in MGD and blepharitis. Here is a quick reference table of some of the most common dry eye tests. Keep in mind, no one test is better than another because they demonstrate different dry eye categories. In conclusion, dry eye diagnosis should be done using multiple levels of testing. Avoid implanting the Raindrop Near Vision Inlay in patients with existing dry eye syndrome. If dry eye syndrome manifests postoperatively, be sure to treat it aggressively.